Coming up onto the stage next, we're going to hear from Ergo Figure. Ergo Figure have developed an innovative wearable device to monitor changes in ankle swelling. So please give a warm welcome to Martin Gray.
Good evening. So I'm Martin Gray. I'm very happy to introduce you to Ergo Figure, but more importantly, to our wearable ankle device, the Eye. We have developed this to help patients, particularly with heart failure, particularly in the critical 3 months after they come out of hospital. We're going to be doing some observational studies in Warwick Hospital a little bit later this year, and then hope to be selling by the end of the year into the NHS. So we're interested in introductions to any more cardiologists or NHS trusts who'd be interested in working with us. Hopefully this will show you why they might be interested. So our team, Paul, who is here tonight, has a background in medtech, a lot of experience. My background's in IT, and we've benefited from a lot of advice, in particular from Dr. Qureshi, a very experienced cardiologist. We've also worked with local universities, Aston University in particular. Heart failure is a big and a growing problem. So there's about 1 million people in the UK living with heart failure. And because of ageing populations and also because of increased survival rates after heart attacks, there's going to be an increasing number of people with heart failure, both in the UK and across the world. So there's a real need for affordable, effective solutions to help those people manage that condition. Once you have heart failure, it's not going away. If you have heart failure, you need to worry about your fluids. You need to manage your fluids. And the reason for that is that there can be a vicious circle where the body detects the problem with heart problem, responds to that by retaining fluid. That actually puts pressure on the heart and makes the condition worse, and you can rapidly spiral down. So doctors, at the moment, encourage patients when they come out of hospital to keep an eye on their ankles. If you can detect the fact that your body's retaining fluid, there are things they can do. They can take diuretics, they can reduce their fluid intake. And if they can do that soon enough, they keep themselves out of hospital and they stay well. So our solution is the Eye. Keep an eye on your ankles. And it's easy to use, it's nice and safe, it's simple, has a quick release. It's fitted once in hospital, and then just a quick release allows the patient to take it on and off. We'd recommend they take it off for a couple of hours a day while they charge it, give the skin a break. But they can wear it. If it goes in the shower, it's not a problem. We think probably the best use case is use it for 3 months, as I say, when they come out of hospital. From the NHS point of view, that means you can then reuse it afterwards. You can clean it and put it on another patient, making it even more affordable and effective for the NHS. Fluid management is known to be the key to managing heart failure, and there are other solutions. So it is possible to have implantable devices. Obviously, that's invasive and expensive and not suitable for all patients. There are solutions with cameras in patients' bedroom. They use AI to look at the volume of a foot. Most patients, however, are seen when they're in clinic, and the doctor prods their ankle and sees how far their finger goes in and how long the dent stays in. That's called a pitting test. So we believe our solution hits the sweet spot of being accurate and simple to use and affordable so that many people can use it. We've come a long way. It's taken a while, but we have patents for the device in the UK, EU and US. We're going through the process of getting a CE mark now, and we've presented a paper at the British Society for Heart Failure. We've benefited greatly from BetaDen. And the advice there help us focus on what we're doing. And we've worked with patient charities such as Pumping Marvellous, a national heart failure charity. They have a group of patient advocates, and we spent some time with them understanding their concerns and talking to them about our design. We also had a small bit of funding from i4i to run a patient engagement survey. 75% of the heart failure patients that we surveyed through that said they would be willing to wear an ankle monitoring device. You can see some genuine quotes there. We've generally received very positive feedback. So what's next for us? we think we're in line with where the NHS is going. The NHS published its 10-year plan, talks about moving from hospital to community and talks about moving from analogue to digital. We think we're in that space. I mentioned the observational study we're running, and then we hope that that evidence will be enough to lead us to sales in the UK, and then we hope into Europe and the US. There are other conditions that it's been suggested by a number of doctors this will be applicable to, particularly chronic kidney disease, also hypertension, and there is the potential for working with pharmaceutical companies on trials. This could give quite useful data. So, our request tonight is just, if you know any cardiologists or NHS trusts you think might be interested, please pass them our way and come and see us at the showcase. Thank you very much.